Good afternoon. I am Michelle Seymour, the Manager of Membership and Community Outreach for the Medical Society of Delaware. And with me today, I have Catherine Simmons from the State of Delaware, Health Program Coordinator for Screening for Life and the Healthcare Connection. We're going to talk to you a little bit today about the VIP program and also Healthcare Connection and Screening for Life and how it can support your practice and your patients. This video is intended to be for practices who may have some new staff who aren't familiar with the program, and this is a great way to introduce it to them. Also for any physician who would like to join the the VIP network to see Healthcare Connection patients. So we're going to get started. Share my screen. As I said, I am Michelle Seymour. We also have staff at the Medical Society who are part of the VIP team. That includes Jessica Penna, who is the Health Services Coordinator, and Pam Taylor, the Pharmacy Coordinator for the program. So just starting off with a little bit of history, the Voluntary Initiative program at the Medical Society was envisioned by Dr. James Marvel. Dr. Marvel is a past president of the Medical Society who served 2 terms, and he envisioned this program to be a way for Delaware physicians who were closing their practices to Medicaid patients to be able to ensure that those practices were not overwhelmed with seeing the patients, and that MSD could be a gatekeeper for the program. Back in the late 1990s, Medicaid moved to managed care. So the shift changed, and the program then shifted to focus on uninsured residents in the state of Delaware. So at that time, the Medical Society of Delaware took action to restructure the VIP program and launched a new version of VIP in 2011. We are proud to say that this past summer, we celebrated our 20th anniversary. We actually did a little press release to announce it. And this VIP program continues to help provide affordable healthcare access to the low-income uninsured people residing in the state of Delaware. As VIP continued to be a great resource for patients who needed to get a health home or see a primary care physician, it also began to be a program to help provide specialty care to those patients. And so the program at the time was called CHAP, the Community Healthcare Access Program. And that, again, program provided help to the low-income uninsured residents of Delaware. Today, the CHAP program is now called Healthcare Connection. It is administered by the Delaware Division of Public Health with funding from the Delaware Health Fund. And the VIP is administered by the Delaware Foundation for Medical Services, which is a supporting foundation of the Medical Society of Delaware. Many times we hear people still refer to the program as CHAP, but it is now the Healthcare Connection. And so we're happy to provide you information about this today. As VIP staff found that patients were able to see a physician, they learned that those patients were in need of additional resources. So the VIP program brought on a pharmacy coordinator in 2007. Pam Taylor is our pharmacy coordinator, and her main job at the VIP is to help research patients' medication, to provide them discounted pricing or free programs to save money on medication. In addition to medication, we also found that there are other resources that those patients were in need of. So we established a diabetes assistance program where patients receive a free bilingual speaking glucose meter, and also some of the additional tools that are required to go with that meter. They also have established resources for durable medical equipment such as CPAPs, walkers, canes, wheelchairs, and other things like that at a much needed cost reduction to the patients. So we are constantly working to find additional resources that we can provide to patients and partner with many community programs to provide these resources to the patients that need it. I think this is one of the most important slides that we're going to talk about today, and that we really need additional help. truthfully, the Affordable Care Act, although it does exist and helps many patients in our state, there are people who are not able to pay for the adequate insurance or are not eligible for the program. So VIP, HCC, and Screening for Life provide a reliable safety net to them by providing over 400 primary care and specialty physicians statewide, but more physicians are needed. On the right-hand side, I have a quick little list of some of the specialties that we're looking to add more physicians to the network. And the reason that we are looking for these specific specialties is that we have a need for patients throughout the state, especially in Sussex County, that we need patients to be seen and we need more physicians to be able to see them. So we are looking to add additional physicians to the network. So the benefits of VIP, I won't go over this whole slide, but there are benefits to being a part of the network and also benefits for the Healthcare Connection enrolled patients. One of the words that you'll see often on the Healthcare Connection side is access. Having access for these patients is extremely important, and we are always working to be able to provide the resources that they're looking for. Also, the dedicated VIP staff and Healthcare Connection staff, you can email or contact us anytime with questions, concerns, and ideas. We are here for you in any way that we can be. So if you're considering joining, you may be asking what is required to you to be a VIP physician. So physicians designate how many Healthcare Connection patients they're willing to serve, how often they are willing to serve those patients, and how much you would like to charge for the office visits. So truly, you do have control of the program in this manner, and you can change this at any time. So we do ask at the time that you enroll to be a VIP physician that you let us know how many patients you can see and what you would like to charge. If at the end of the year you realize that you can see some more, we are happy to adjust that number. We understand we don't want to overwhelm anyone, and we can also dial that back if needed. The VIP staff do track the patients assigned to the physicians, so we do honor the limits that have been placed, and we just need to hear from you if any changes need to be made. So I'm going to switch it over to Catherine to talk about eligibility for the program.
Thank you, Michelle. So at Screening for Life and Healthcare Connection, we are located at the Thomas Collins Building in Kent County, Dover, Delaware. At Screening for Life and Healthcare Connection, it is a two-part program, but this is where your clients would enroll to be eligible for Healthcare Connection. So who is eligible for this program? In order to be eligible for the program, a patient must be uninsured, be at or below the 200% of the federal poverty level, not be qualified for any other public health insurance option, and they also must be exempt or ineligible for the Affordable Care Act Marketplace. At the Division of Public Health Healthcare Connection program, we determine the participants' eligibility. And then to inquire more about our program, you can always reach out to 211. It's the Delaware helpline, and they'll get you right over to our office. So for patient enrollment, each patient applies for the program by completing their application, and it is submitted to and processed by our enrollment staff at Screening for Life and Healthcare Connection. It's just one application for both programs, Healthcare Connection, HCC, or Screening for Life, which you'll see as SFL. Patients may be enrolled in both, possibly just one program, depending on their need. Factors such as age and insurance coverage may affect their enrollment. DPH coordinators, HCC coordinators, contacts the VIP staff at the Medical Society of Delaware to advise which patients are enrolled. We reach out to Jessica, and she will be able to help us get them assigned to a primary care, and any medical referrals that they may have, she'll get them connected with whom they need to be connected with. So patients are referred to see a VIP doctor in a number of different ways. They'll be referred by a enrollment specialist in the office. And typically that's going over their application and kind of seeing some concerns that they may note. And we will reach out to Jessica and have them referred to the correct specialist. That would also work with Jessica, the VIP health coordinator, working to get those referrals made. A client could reach out and contact her directly as well. They're also referred by a federally qualified health center health promotion advocate. So in our federally qualified health centers, we also have an enrollment team that works, and they again would help that client when they see them there get referred with the VIP program. And they can also come from any other state agency or community. And then I'm going to have a nice little scenario to go over that just kind of gives us a good example of how the application process would kind of work for a client. So we're going to meet Maria. She has a modest income and has recently lost her health insurance. Maria's 55 and she lives alone in Newcastle County. She currently receives unemployment but's not eligible for Medicaid. She is also not eligible for any other public health insurances. Maria has diabetes, which requires daily glucose testing and insulin. And she also has high blood pressure, high cholesterol, and uses a CPAP machine for her sleep apnea. Maria knows that she needs to take care of her health. So we have Maria apply for the program by completing an application, and it's submitted and processed by Healthcare Connection. Again, it's just one application, and she may be enrolled in both programs depending on certain factors like age and insurance coverage. So our coordinators, our enrollment staff, HCC enrollment staff and coordinators will contact the VIP staff at the Medical Society of Delaware to advise that Maria has been enrolled, and Jessica Penna, the VIP health services coordinator / HCC coordinator, will assign her to a primary care physician to handle any medical referrals she needed. Knowing that Maria needed resources for her diabetes, her blood pressure, and her sleep apnea, Maria is referred to the VIP's pharmacy coordinator, Pam Taylor.
So Pam talks to Maria about her CPAP machine and needing a replacement. So as you can see, Maria needs a new CPAP machine and new supplies. A lot of the costs of these supplies and CPAP machine are at a greater reduction than what Maria would pay if she were to go and buy it via retail. So the next thing that Maria talks to Pam about would be her medication. Pam would find out all the medications that Maria is currently taking, including ones that she can't afford to fill or over-the-counter prescriptions and things like that. And Pam is able to provide her with some reduced cost medication options. Maria then learns about the VIP diabetes program. With this program, she gets a free glucose meter. This glucose meter is bilingual and can use alternate sites to take the information that it needs. It can also be uploaded to her physician's computer. She gets the discounted test strips, discounted lancets, and the lancet device, all at about a 50% reduction in the cost that she would pay if she were to go on someplace like Amazon to buy this herself. Maria also finds out about some of the community programs that are available. So Pam, in addition to what she knows would be helpful to Maria, she also shares some of the other resources that are in the community that she might be interested in taking a part of, such as, you know, nutritional classes, shopping with the dietitian, and so many other things. So how can you help your patient access assistance through VIP? I think one of the most important things is that if you will see a patient and at that patient's discharge, when you know that he or she needs to be referred to a specialist, make sure they have Jessica's contact information. You also want to send a referral form to Jessica that includes the patient's notes from the last relevant office visit. If the patient that you saw needs a prescription or other durable medical equipment, we want to make sure that they know to contact Pam Taylor, who can help with that. And every patient at the time of enrollment is provided with a Healthcare Connection patient services flyer that has the contact information for VIP and HCC staff. This is just a quick snapshot of the patient services flyer. It is a two-sided form, one side being in English and one side being in Spanish. We provide these to every patient as they're enrolled in the program. And this quick little reference guide just tells them who to call if they have a particular question. So if they have a particular general medical question, or perhaps they received a bill that they don't understand and need some assistance with, this tells them who to call and what would happen next. If there's something that you're interested in having at your office, we can certainly send some to you, but do keep in mind that we do give these out to every patient that gets enrolled in the program. So hopefully, upon hearing about the program and how it helps so many of the people in our state, you're interested in joining. So what is next? There is a simple registration form that you would complete and either fax or email to the VIP staff at the Medical Society. Pretty soon, I will have the registration form available on our MSD website. Quick snippet of the Medical Society of Delaware homepage. You can just search VIP in the search box that will take you to the page that will soon house the registration form. But you can also go to the homepage, click on what we do, and then click on initiatives, which will take you to the site page that you need. There's also a link to the Healthcare Connections website on this page also. Just to round it out, I have the contact information for myself, for Jessica, and for Pam. We also have our Medical Society of Delaware website and the State of Delaware website listed here. I hope that this information has been very helpful for you and that you are interested in joining, or if you have any questions, please let us know. Thank you.
Thank you.